One of the questions I get asked all the time by patients is how to use heat. This video will demonstrate the proper use of heat therapy. The basic guidelines for applying heat are always use moist heat. Forget about your heating pad. Apply heat for short intervals of 8 to 12 minutes. Don't use heat if you have loss of sensation and cannot feel if it is too hot, if you have burns, circulatory problems, infections, malignant tumors, or on a new injury. To start moist heat therapy, you will need 2 towels, a source of water, a microwave, and a timer. Saturate the smaller towel with water and squeeze out the excess so it doesn't drip. Place in the microwave for 30 to 45 seconds. Afterward, check the temperature of the towel, but be very careful because it will heat very quickly and can be hot enough to cause burns. Once the correct temperature is achieved, place the wet towel on the area to be treated and cover it with a large, dry towel. This serves to hold the heat in rather than letting it escape. Certain areas may benefit from the use of an ACE bandage to keep the towel from falling off if you can't stay still for the entire treatment. Remember, the purpose of heat is to increase circulation. Consequently, the area being treated will be red when the compress is removed. We offer a free health consultation or injury assessment to determine the best course of treatment for you. We will even review your x-rays or MRI at no charge. Give us a call to start a healthier life today. One of the questions I get asked over and over and over again by patients is how to use ice. The purpose of this video is to demonstrate the proper use of ice. The basic guidelines for applying ice are: do not apply ice directly to the skin. Always use a dry cloth or towel between the skin and ice pack. Apply ice for 20 to 30 minute intervals. Do not apply ice on an area that has numbness or circulatory disorders. Stop using ice if you develop hives, itching, or a significant rash. To start, you will need an ice pack, 2 towels, and a timer. Next, find a location and a position that will be comfortable for 20 to 30 minutes. It's even a good idea to have your phone nearby so it's handy. Place a towel on the area to be treated and put the ice pack on it. Now, cover the ice pack with a larger, thicker towel. This serves to keep the cold in rather than letting it escape. Now relax. Certain areas may benefit from using an ACE bandage to keep the ice from falling off, especially if you can't stay still for the entire treatment. You may feel different sensations like aching to itching or even burning. These should be mild and dissipate within a few minutes. If not, try using a thicker towel between the ice pack and skin. If the symptoms persist or become severe, discontinue use of ice and consult with your doctor. Ice therapy can be used multiple times, but it is important to rest at least 10 minutes between treatments. This technique is most commonly used with new injuries, severe pain, or noticeable swelling following an injury. Remember, the purpose of ice is to decrease pain, inflammation, and swelling to speed up the healing and recovery process. We offer a free health consultation or injury assessment to determine the best course of treatment for you. We will even review your x-rays or MRI at no charge. Give us a call to start a healthier life today. When, why, and how to use ice are questions that patients ask me over and over and over again. The purpose of this video is to explain when and why to use ice. There are some simple rules to follow when using ice. Always use ice on a new injury. If your pain level is greater than 5, make sure you use ice. When in doubt about using ice or heat, use ice. Never apply ice directly to the skin. Always use a cloth between the ice pack and the skin. The important thing to remember about ice is it decreases circulation, which helps to reduce pain, inflammation, and swelling. Some people may experience throbbing or aching when they use ice. This can usually be relieved by using a thicker or thinner towel with the ice pack. If this persists, you should discontinue use of the ice and talk with your doctor. When done correctly, ice is extremely effective at reducing pain, inflammation, and swelling, which speeds up the healing and recovery process. We offer a free health consultation or injury assessment to determine the best course of treatment for you. We will even review your x-rays or MRI at no charge. Give us a call to start a healthier life today. When, why, and how to use heat are questions I get asked all the time. The purpose of this video is to explain when and why to use heat. There are some simple rules to follow when choosing heat. Always use moist heat because it is more penetrating and therapeutic. Avoid heating pads. They may keep you warm, but they are not therapeutic. Be very selective about using heat, and when in doubt, use ice. Most people prefer heat and often use a heating pad because it sounds right or feels better. Unfortunately, these are the wrong reasons. Heating pads tend to aggravate inflammation, increase swelling, and make pain worse. The important thing to remember is always use moist heat because it is more soothing and effective. Moist heat is most commonly beneficial with chronic conditions that do not involve significant pain or swelling. When properly applied for 5 to 10 minutes, moist heat provides excellent relief and improved function. We offer a free health consultation or injury assessment to determine the best course of treatment for you. We will even review your x-rays or MRI at no charge. Give us a call to start a healthier life today. There are some simple rules to follow when choosing ice or heat. Use ice on new pain and new injury. Always use ice if your pain level is greater than 5. When choosing heat, always use moist heat because it is more penetrating and increases circulation. Avoid heating pads. They may keep you warm, but they are not therapeutic. Be very selective about using heat, and when in doubt, use ice. When choosing ice or heat, think in terms of circulation, inflammation, and swelling. Ice decreases these effects while heat increases them. That is why ice is best for new injuries and severe pain, while heat is effective for chronic conditions that do not have severe pain or inflammation. In my experience, ice should be used about 70% of the time unless you know your condition responds best to heat. Proper selection of ice or heat will make the difference between effective treatment or possibly feeling worse. We offer a free health consultation or injury assessment to determine the best course of treatment for you. We will even review your x-rays or MRI at no charge. Give us a call to start a healthier life today.